Vaginal discharge, an important indicator of your health. Vaginal discharge is a normal and important bodily function in women and people with vaginas. It serves to keep the vagina clean, moist, and protected from infection. The characteristics of normal vaginal discharge can vary depending on the stage of the menstrual cycle. However, significant changes in color, consistency, odor, or amount can indicate an underlying health issue. Here's what you should know about vaginal discharge.
What is normal vaginal discharge?
Normal vaginal discharge is usually color: clear or white, but can also be off-white or slightly cloudy. Odor: mild or no odor. Consistency: can range from watery and slippery to thick and sticky throughout the menstrual cycle. It tends to be heavier during ovulation, sexual activity, pregnancy, and with the use of birth control pills. Amount: varies from person to person. Some individuals naturally produce more discharge than others.
Why is vaginal discharge important?
Cleansing: it helps to shed dead cells and bacteria from the vagina, keeping it clean. Lubrication: it provides lubrication, which is important for sexual intercourse. Protection: it helps to prevent infections by maintaining a healthy pH balance in the vagina.
When might vaginal discharge indicate a problem?
Changes in your vaginal discharge may be a sign of an infection or other health problem. It's important to consult a healthcare provider if you notice any of the following. Change in color: discharge that is yellow, green, gray, or has a brownish or blood-tinged color, especially if not during menstruation. Change in odor: a strong, foul, or fishy odor. Change in consistency: discharge that is thick and white like cottage cheese, frothy, or pus-like. Increased amount: a sudden and significant increase in the amount of discharge. Accompanying symptoms: itching, burning, irritation, redness, or swelling in or around the vagina, pain during urination or sexual intercourse, or pelvic pain. Common causes of abnormal vaginal discharge. Several conditions can cause changes in vaginal discharge, including bacterial vaginosis, BV, often characterized by a grayish-white discharge with a fishy odor. Yeast infection, thrush, typically causes a thick, white discharge that may resemble cottage cheese, along with itching and irritation. Trichomoniasis, a sexually transmitted infection, STI, that can cause a yellow, green, or frothy discharge with a foul odor. Chlamydia and gonorrhea, other STIs that may cause changes in discharge, often accompanied by pelvic pain or bleeding. Pelvic inflammatory disease, PID, an infection of the reproductive organs that can cause a yellowish discharge with a foul odor, along with pelvic pain and fever. Forgotten tampon, can cause a foul-smelling discharge. Cervical cancer, in rare cases, brownish or blood-tinged discharge can be a sign of cervical cancer. Vaginal atrophy, thinning and drying of the vaginal tissues due to decreased estrogen levels, common after menopause, can sometimes cause discharge. Irritants, certain soaps, douches, or scented products can irritate the vagina and cause abnormal discharge.
What should you do?
If you are concerned about changes in your vaginal discharge, it's essential to avoid douching. Douching can disrupt the natural balance of bacteria in the vagina and worsen infections. See a healthcare provider. A doctor can properly diagnose the cause of your abnormal discharge through a pelvic exam and possibly lab tests. They can then recommend the appropriate treatment. In conclusion, paying attention to your vaginal discharge is a good way to monitor your health. While some changes are normal, others can signal an underlying issue that requires medical attention. Don't hesitate to consult a healthcare professional if you have any concerns.